The war between Israel and Gaza has now claimed 2,300 lives. The wounded are flooding into hospitals on both sides of the border. We are joined by our resident medical expert, board-certified ER Dr. Michael Daignault. Now, a lot of people may not know this, but you actually graduated medical school in Israel. You're in touch with colleagues on the ground there. What are you hearing?
Yeah, so we got an email from our director today that was sent to all alumni. And so Soroka Medical Center, which is the teaching hospital affiliated with Ben-Gurion University, where I went to med school, is only about 40 miles from the Gaza Strip. It's about 40 miles southeast of Gaza, and it's the largest regional medical center for southern Israel. So even when I was there, my first and my last year, we were there during conflicts with the Palestinians. So very familiar with this situation, but nothing on this scale. And so the director said that on Saturday, Soroka ER saw 800 patients, and that's a lot for them. And typically they see about 250,000 patients in the ER every year, but a lot of patients coming in with traumatic injuries, projectile injuries, gunshots, stabbings. Then you have the blast injuries from the rocket attacks as well. And like I said, Soroka covers a very large area of the Negev Desert in southern Israel.
And how is the supply flow? Because we know that that's an issue as well.
Yeah, I think everything is kind of in flux right now, and I think they're doing the best they can, because if you think about any ER, you have to handle your typical volume of medical emergencies, as well as, now they're gearing up for if there's a ground offensive to Gaza. A lot of those soldiers, the closest regional medical center for trauma is Soroka Medical Center, where I trained, and I have to say, the training that I had there, the medics, the professors, I mean, that was a huge inspiration for me to be an ER doc. So I wish them the best.
Well, I know, and you're wearing blue in honor of Israel tonight.
Correct.
So I know it comes from the heart. Switching gears now to, I think we're all stunned to hear this headline that Mary Lou Retton, the Olympic gold-winning gymnast, of course, that she is fighting for her life in the ICU with a rare form of pneumonia. The 55-year-old, she's not breathing on her own, and according to her daughter, she does not have health insurance. What do we know about her prognosis and this rare form of pneumonia?
Right, so the information we have is limited to that Instagram post that Mary Lou Retton's daughter put out, and so a couple of things we can glean from that. One, the rare pneumonia. Now, does that mean it's a pneumonia that's not seen frequently, or is it a pneumonia that's antibiotic resistant? I mean, both of those situations would not be ideal. The other thing we can learn from this is she said she's not breathing on her own. So to me, that tells me that she's ventilated, that she's on a mechanical ventilator, that her oxygen might have been at a lower level than they wanted, and so then that's when you have to put someone on a mechanical ventilator, take that over for them. And she's already been there a week, so the prognosis is poor, I would say, and we just hope that she hangs in there.
Does it matter? Do you factor in, I'm sure it does matter, the fact that she is such an athlete?
Right, yeah, you would hope, and that would make a big difference, and we don't know what kind of chronic medical problems that she may have as well. And so, I think just the rarity of the pneumonia that you're speaking of and the mechanical ventilation, I mean, those are two things that are huge factors there.
Okay, talking about COVID, you joined us not long ago, and you talked about the fact that COVID testing has changed, where you now recommend that people swab the back of their throat in addition to their nasal passage. Now you say that the timeline of when you should test has changed. How so?
So as you mentioned, we've had a lot of patients in the ER, and we certainly know of a lot of people that would come down with COVID, test themselves, be negative, and be like, I really think that this is COVID. And we've seen patients come into the ER, we do a PCR test, and it turns up positive, or they go to urgent care, it turns up positive. So the question is, when is the ideal time? So there was a really interesting study that just came out of 300 people, and it found that on day 4 of symptoms, the viral load was the highest. And that's when the rapid test is most likely going to pick up the infection. So I would recommend people try, if you can, wait those 4 days, and on day 4, that's when your best chance of testing positive. And if you're negative on day 4, you're probably really negative. And as you mentioned, you want to swab the back of your throat as well. That definitely increases the yield of the test.
Because that's where COVID is now presenting.
Starting in the back of the throat and then making its way to the nasal passages.
Okay,
right?
So day 4, that's the takeaway.
That's the one, yeah.
Okay, Dr. Michael Daignault, thank you. And of course, our thoughts and prayers with all your colleagues in Israel.
Thank you.
Thanks so much.